Hi, my name is Deborah Duncan. I work for Salus Gate, and as you understood before, I'm a facilitator. So is a company that is a facilitator company in Italy, and we are based here, even if I travel a lot. We are based here, and we are focused on incoming patients. Even if we have the possibility to have a very good network for the outgoing patient. But we mainly think that, as I said before, healthcare in Italy is really one of the best, but is not pushed in the right way. So we have an innovative approach. As Nada said, we are really good because we think as preventive care is something so important that you have to look after, because people are interested in prevent what is going to be from a healthcare point of view. So we organize package for from other countries that people can come have a checkup, and they can have also wonderful trip plan in the most beautiful cities in Italy, as Milan, Rome, Bologna, Florence. We have another part of the company that look after a specific need from the patient. So we can tailor-made, if we talk about surgery, for them exactly what they need and what are expecting from our clinics and hospital. And we have another area, very interesting and very new, is Salus Edu. It's because in other countries, maybe they have a beautiful hospital, a wonderful clinic, and wonderful places, but maybe they don't have the good knowledge of a specific surgery. So we organize for them a training course, even in their country, to maybe specialize themselves in some surgery. Oh, thank you. So, as I said, we work in the Italian market, and we are in the health segment. As I said before, and I did speak with Perazzini, I said it's important to follow the patient from the beginning to the end, door to door, because when they are in another country, they feel really weak, and they really would like to have somebody that they can just say what they need and what they are afraid of. So we are very personalized. We like to have all the weakness we can support for the patient is important, but just not the patient, also the family. We look after them during the entire stay of the patient. So if I make an example, because this market and this process is really, really complex. If I talk about a company, the company is divided in department. So we have the marketing department, the sales department, the administrative department. But all departments are working as a only company. So we are like the one that is going through all the department and take our patient through all the department, because they know their input and their output, but they stop there. So we have to follow the patient to support him until the end, and support also on the post surgery. That part is really important, because they don't, if they finish the surgery and think that, okay, I can go home and that's it, they feel much more weak and afraid, because if something's going wrong, they don't know where and how to contact anybody, so we are there to help them. We were also important for us to work with consultants. So we are a company that we think is really important to work with the best consultants. So we are thinking that different segment has to be followed with different consultant and with different expertise. Thank you. So we strongly believe that preventive care and checkups is the most important thing to do now and in the future. Another thing really important is we are independent, so we are not linked to any kind of clinics or hospital. We try to find the best solution for our patient. And how? At the right moment, at the right solution, at the right time, with the right consultant. We also think that is really important, not just the part of the healthcare. We also think about the part of tourism. So the tourism is something important, so we are having a partnership with different tour operators that help us to solve this part. That is not our core business. Our core business is to look after the health of our patient. Just because we think it's very important to talk about numbers, why we invest so much in preventive care. We invest so much in preventive care because in 2050, it's considered that 2.4 billion in the world will be more elderly people. So preventive care is really important because if you are considering that the average age of women will be 86, and it's considered, and the average life for a man will be 83. If they have a preventive care from 50 to 70, they maybe will find some disease that at that point could be really easy to solve or to look after or to monitoring. But if you don't have any kind of preventive care, you consider that is not important, you will lose a possibility to live better and longer. Another point that it says that in 2017, we analyzed that more than 70 million patients every year. They travel abroad or worldwide for healthcare. And you know, they generate a turnover as more than 90 million euro. And if you consider that number is considered that in 2018 could be 130 billion euro more. And also, the revenue in Europe for medical tourism is already 12 billion euro, and that 12 billion euro is considered that 17% is already in Italy, and could be growing in the future, double. So we do believe that preventive care is very important to live longer and better. Last but not least, medical care is so important, and the Italian medical tourism market is rapidly expanding. More than 50% of the people are traveling to the US, and more than 40% are moving to Europe. We can consider the two different kind of segment. One is moving for the excellence, and most of them are going to US or Europe. And the other one is low cost. But the low cost is not because the quality is not good. It's because the cost to sustain is less, the cost of life, so this is the main reason. Another point that I said before, Italian SSN is worldwide recognized as one of the best, considering in quality, service, clinics and hospital, and finally for the particular specialties of the consultants. So, just to summarize what we think about Salus Gate, think that Italy is a very potential good market for healthcare, and it's not, everybody knows Italy for other things. We have to move forward and think that is important to push the healthcare market, because we are really good on doing that. So to conclude my presentation, Italy, I don't know, nowadays patients are very well informed. For this reason, we have to be really well organized, and we have to begin and follow every phase in the process. Integrate with all the stakeholders, like the tour operator, the healthcares, and all the others. And the patient needs to be supported by person during the entire process. So, you can do it.
Thanks, Deborah.
Thank you very much. We are on stand 22 if you want to come. So thank you very much for everything.
Thank you so much.